This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Marko Ojdanich recaps the article, Waste in Ophthalmology ORs, which he wrote with Dr. Albert Corey and Jasmine Mahajan for a recent issue of Glaucoma Today. The article discusses the growing environmental burden of the healthcare sector and strategies for reducing waste in ophthalmology ORs, much of which results from single-use equipment and devices. Later, Dr. David Chang shares the mission of isustain.org, a web-based resource center for sustainability in ophthalmology. The goal of iSustain is to educate the global ophthalmic community on reducing waste in the OR and clinic, and to make available relevant studies and position papers that can be used to advocate for change within institutions and facilities. Dr. Chang's article on the initiative was written with Dr. Cassandra Thiel and featured in GT. First, we hear from Dr. Ojdanich.
The United Nations established strategies to reduce greenhouse gas emissions, but human-induced global warming continues to threaten global health. The healthcare sector accounts for 4.4% of global emissions. In the United States, the healthcare sector's climate footprint amounts to about 10% of total greenhouse gas emissions. As surgical technique and instrumentation evolve to become more efficient, the environmental burden may grow. The carbon footprint from the operating room alone is an estimated 3,000 to 5,000 tons of carbon dioxide per year. The amount of medical waste, moreover, increased dramatically during the COVID-19 pandemic owing to the increased use of personal protective equipment. Ophthalmology is no exception to these trends. The popularity of single-use equipment and devices as a means of lowering the risk of infection and reducing post-operative complications has produced an explosion of medical waste. Growing awareness of the problem is spurring initiatives to reuse or re-sterilize as much equipment and medication as possible. Surgical waste can accumulate quickly and is often collected before the surgical day concludes. Some medical equipment, including syringes, needles, tips, and empty intraocular lens cartridges, is designed for single use. Gonioscopy lenses and applanation tonometer prisms used to be reusable, but nearly all of those currently manufactured are disposable, increasing plastic waste and healthcare costs. Some disposable gonioscopy lenses have been investigated to see if they cause any deleterious effects or influence patient outcomes when compared to those that are reusable. It was concluded that there are no differences in efficacy in reducing intraocular pressure when disposable or reusable lenses are used, suggesting that reusable lenses may be an environmentally friendly option. Many commonly used tools can be reused but are not. For example, marking pens may be used repeatedly but are often disposed of after making a single mark. Needle containers can hold up to 20 needles but are disposed of after each surgical case, as are partially filled containers of dilating drops and balanced salt solution. The amount of surgical waste is greater in the United States than in some other countries. In one study, approximately 1 kilogram more waste was generated per trabeculectomy at an eye care facility in Baltimore compared to one in India. This is interesting because India has far fewer regulations governing the use and disposability of surgical equipment. Moreover, the rate of endophthalmitis reported following phaco emulsification was lower in India than in the United States, 0.01% versus 0.04%. One strategy for reducing operating room waste in ophthalmology's carbon footprint is to separate waste from recyclable material. Eye care providers, healthcare administrators, and manufacturers can also reevaluate the benefits and drawbacks of strict regulations on products for which the risks of contamination are not well studied. The theoretical adverse effects of reusing eye drops, gonioscopy lenses, and tonometer prisms are not equivalent to the measurable financial and environmental burden of the waste produced. Efforts at reducing environmental costs without sacrificing surgical technique and increasing postoperative complications have shown great promise in several countries, creating an opportunity for a shift in others, including the United States. Studies have found that trainee surgeons generate almost 25% more waste than experienced surgeons. Efforts to reduce greenhouse gas emissions could be augmented through waste reduction education starting at the trainee level. There is a dearth of research on the environmental impact of surgical waste in ophthalmology. Studies should be designed to trial different approaches to waste reduction.
Coming up, here's Dr. Chang with more information on how the Eye Sustain initiative is supporting efforts to reduce ophthalmology's environmental impact.
In 2020, we published the results of the first large survey of ophthalmologists on operating room waste. The survey was conducted by the Ophthalmic Instrument Cleaning and Sterilization Task Force, abbreviated OICS, which has representatives from ASCRS, AAO, the Outpatient Ophthalmic Surgery Society, or OOS, and the Canadian Ophthalmology Society. Of the more than 1,000 ophthalmologists who responded, 98% believe that OR waste is excessive, 78% believe that more surgical supplies should be reused, 91% were concerned about climate change, and 87% wanted their medical societies to advocate for reducing the carbon footprint of ophthalmic surgery. The strong consensus of opinions captured by the survey inspired the creation of eyesustain.org, a web and app-based resource center for sustainability in ophthalmology. Its development addresses the need to centralize information and resources related to sustainability in ophthalmology. The website was launched on Earth Day during the 2022 ASCRS annual meeting. The mission of iSustain includes 5 objectives. First, to engage, network with, and educate the global ophthalmic community about more sustainable practices. Second, to collaborate with industry to reduce ophthalmology's carbon footprint and surgical waste. 3, to support research and innovative solutions for reducing ophthalmology's environmental impact. 4, to collaborate with other medical specialties on reducing the carbon footprint of our healthcare system. And finally, to support advocacy and education about the effects of climate change on public health. Funded initially by the ASCRS Foundation and developed by an advisory board with expertise on sustainability in healthcare, the eyesustain.org website has several major sections. One focuses on reducing OR waste and has an online carbon footprint calculator. Relevant studies and position papers from the OICS task force are archived here. Other sections focus on reducing ophthalmic drug waste, making clinics more sustainable, and sharing global best practices in ophthalmology. Each section has a resource library with references to the peer-reviewed literature that can be used to advocate for change within institutions and facilities. Surgical manufacturers have been invited to share their waste-reducing initiatives in a section dedicated to industry collaboration on making surgery more sustainable. Another section provides pertinent information on the effects of climate change on public health. The European Society of Cataract and Refractive Surgery, the AAO, and ASCRS have now united to become co-sponsors of iSustain. The goal of this unique partnership is to develop a global consortium of ophthalmic organizations and societies committed to promoting the sustainability of eye care through advocacy, collaboration, and education. At the time of this recording, we have now added 37 other global member ophthalmic societies, all of whom will incorporate sustainability into their educational programs. They will designate representatives to a global iSustain council, and they'll establish a committee on sustainability to engage interested members. An example of the power of collaboration is the OICS Task Force position paper on topical drug waste in ophthalmic surgery. Endorsed by ASCRS, AAO, OOS, and the American Glaucoma Society, the document was released and posted on isustain.org in April of 2022. The evidence-based paper documents the policies of multiple regulatory and accreditation agencies and clarifies that multi-dose bottles of topical drugs may be used on multiple patients until the labeled date of expiration. In our OICS survey, 98% of respondents expressed a willingness to use multi-dose bottles on multiple patients in the perioperative area, but less than half of them were currently doing so. The respondents who were practicing in hospitals were far less likely to be reusing the bottles than those operating in ambulatory surgery centers. A separate unpublished OOS survey, however, found that 88% of ambulatory surgery centers discarded the multi-dose topical drug bottles at the end of the day or the week or the month instead of using them until the date of expiration. After meeting with the OICS task force, CMS issued a clarification to its surveyors that topical drops for surgical patients are not subject to the 28-day expiration policy that applies to injectable medications. The OICS position paper also recommends that surgical patients requiring a topical medication not used for other patients be allowed to bring that partially used medication home for their postoperative use. isustain.org makes it easy to locate and share resources such as multi-society position papers within the global community. The aim is to help ophthalmologists around the world affect policy change within their own institutions.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.